I want to thank all the deputies across the House for their contribution in this debate, and on behalf of my colleagues Minister Donnelly, Minister Rabbitte and Minister Butler, I'd like to provide assurance that this Government is acutely aware of the importance of respite for service users and their families and remains firmly committed to ensuring increased capacity is built into respite services provided by or on behalf of the HSE. This Government is committed to providing services with supports for people with disabilities, which will empower them to live their lives, provide greater independence in accessing the services they choose, and in addition, overarching government policy is to support older people to live in dignity and independence in their own homes and communities for as long as possible. The Government recognises that family carers play in the provision of care in Ireland, and I'd like to restate what my colleague Minister Butler said about family carers and how they are the backbone of care provision in our country and have cared for the most vulnerable in our society during the COVID-19 pandemic. The need for increased provision for persons with disability and older persons is acknowledged by Government and is reflected in the HSE's National Service Plan for 2021 to 2022. The Government's commitment to improving services and supports for people with disabilities and their families was demonstrated in Budget 2022 with a total budgetary allocation of over €2.3 billion, which included funding to reflect the importance of respite breaks as part of the overall suite of services available for people with a disability and their families. Building on 2020 funding for respite services of circa €70 million in 2021, funding of €5 million provided for 9 additional centre-based respite services to provide 10,400 additional respite nights, along with a range of alternative respite projects including Saturday clubs, breakaway schemes and summer schemes. The number of overnights with or without day respite accessed by people with a disability in 2021 is advised as 94,606. The number of day-only respite sessions assessed by people with a disability in 2021 is advised at 16,306. Budget 2022 provides €9 million to build the capacity of respite services, with the Government committed to the establishment of 3 additional specialist centre-based services. One to provide specialist care for people with Prader-Willi syndrome, and other 2 to provide high support respite for children and adults with complex support needs. These centres are expected to provide 4,032 nights to 90 children and young adults with complex support needs. Additionally, funding for further respite services is provided for in Budget 2022, which will provide 9,408 nights to 245 children and adults in a full year. Government also provided an unprecedented level of investment in the 2021 budget to improve access to primary care services and older people services, including €150 million of additional funding for home support to progress the development of a reformed model of service delivery to underpin the statutory scheme for the financing and regulation of home support services. This funding has been maintained into 2022, providing for 5 million more hours of home support. The overarching policy of Government is to support older people to live in dignity and independence in their own homes and communities for as long as possible. And where this is not possible, the Health Service Executive supports access to quality long-term residential care where this is appropriate. Access to residential care is based on both the needs of the older person and the carer, and can take place within their own home or in a residential unit managed by the HSE, voluntary agencies or by private providers. Respite can occur in a variety of settings for various lengths of time, depending on the needs of the individual service user and their family or carer. Respite is not always centre-based and can be provided in a number of ways. For example, centre-based, in-home, home-to-home, family support, etc. And as a vital part of the continuum of services for families, respite potentially helps prevent out-of-home full-time residential placements, preserves the family unit and supports family stability. However, the provision of residential respite services has come under increasing pressure in the past number of years due to a number of important factors. An increase in the number of children and adults who are seeking to access to respite as a reflection of general population increase, increasing levels of complexity across the sector due to better and improved healthcare, an increase in the age of people with a disability resulting in people presenting with changing needs, and the impact of regulatory standards and national policy on capacity. As was set out in the opening statement, the COVID-19 pandemic resulted in the closure of some residential disability services in line with public health sector advice. And I do acknowledge this has been difficult for many people with disabilities and their families. And respite services operated at a reduced capacity throughout the pandemic. And this was as a direct impact of prevailing public health advice at that time to keep some of our most vulnerable safe during the pandemic. During this time, some respite centres remained open, while others were temporarily repurposed as isolation facilities, and the use of targeted 1-1 home support hours were offered in lieu of respite in circumstances subject to the appropriate risk assessment. Throughout the pandemic, the staff and resources associated with closed or curtailed services were redeployed where possible to support residential provision and to provide for targeted in-home, community and online supports for service users and families based on prioritised needs. For those with a disability and their families and for older persons, the impact of the pandemic and those services has presented challenges, and the human cost for those affected by the reduction in respite services as a result of COVID-19 cannot be underestimated. The Disability Capacity Review to 2032, a review of disability, social care demand and capacity requirements to 2032, published in July 2021, set out additional respite capacity that will be required in light of Ireland's anticipated demographic change and what is required to address unmet need. And following the commitments in the 2020 programme of government to work towards implementing the findings, a Disability Action Plan framework was also published in July 2021, alongside the terms of reference for an interdepartmental working group to develop this action plan for submission to the Cabinet Subcommittee on Social Affairs and Equality. The action plan, which is in the process of being finalised, will help to guide government to ensure that we can plan ahead to meet changing needs and demographics and ensure that people with disabilities can get the right services, the right place at the right time. It is also intended to work towards providing equitable access to respite services irrespective of where people reside in, and while challenges remain, the need for increased respite provision is acknowledged and reflected in the HSE's National Service Plan for 2022. In conclusion, it's important to note the Government aims to prioritise policy actions that protect the most vulnerable, including those both in caring roles and those that care for as our economy returns to growth in the aftermath of the pandemic. The Department of Health is committed to working with other government departments to ensure that they are providing the most appropriate supports to sustain careers in their caring role. Officials from the Department of Health recently partook in the annual Carers Forum hosted by the Department of Social Protection. And this annual forum is a forum for family carers and representative organisations to voice their concerns on caring in Ireland and their priorities to support them in the caring role. The National Carers Strategy aims to recognise and respect family carers as key care partners where carers are supported to maintain their own health and well-being and to care with confidence. To conclude, I can assure the House that the Government is as determined as ever to providing timely access to high-quality health and social care services, including respite services, for all children and adults who require them. And as Minister of State and Minister of Disabilities and Minister of State for Mental Health and Older Persons, Minister Rabbitte and Minister Butler, are acutely aware of the respite service for service users and their families. And respite remains a key priority, reflected in the funding commitments achieved for the development of new respite centres and alternative respite and expansion of existing services. Thank you.